Hello, wishing you a happy, healthy day full of energy. Please like and subscribe to us. Following our health practitioner's advice will help reduce the risk of cardiovascular disease and maintain a healthy heart. If you have any unusual signs or symptoms, see your doctor immediately. Here's what doctors say. Myocardial infarction, MI, commonly known as a heart attack, is a serious medical condition that occurs when blood flow to part of the heart muscle is blocked, usually caused by a blood clot in the coronary artery. This leads to damage or destruction of myocardial tissue due to lack of oxygen. The severity of a myocardial infarction depends on many factors, including the extent and location of the damage, the length of time it lasts before treatment, and the patient's overall health condition. Signs of myocardial infarction. 1. Chest pain. Feeling of pain, pressure, or heaviness in the chest area. Pain may spread to the shoulder, arm, usually the left arm, back, neck, jaw, or stomach. The pain lasts more than a few minutes or goes away and comes back. 2. Difficulty breathing. Difficulty breathing or shortness of breath. Often accompanied by chest pain, it can occur both at rest or during activity. 3. Sweating. Sudden cold sweat. Feeling drenched in sweat, not caused by environmental temperature or physical activity. 4. Nausea or vomiting. Feeling of nausea or vomiting may be accompanied by abdominal pain or upset stomach. 5. Dizziness or fainting. Feeling dizzy, head spinning, loss of consciousness or fainting. 6. Fatigue. Feeling tired for no apparent reason, often appearing suddenly, especially common in women. 7. Discomfort in the upper body. Discomfort or pain in one or both arms, back, neck, jaw, or stomach. How to prevent heart attacks. 1. Maintain a healthy lifestyle. Diet. Eat lots of vegetables, whole grains, fish, and chicken. Limit your intake of salt, sugar, saturated fat, and cholesterol. Avoid fast food and processed foods. Do exercise. Exercise regularly for at least 30 minutes a day, 5 days a week. Include activities such as walking, running, swimming, or cycling. No smoking. Stay away from cigarettes and smoky environments. If you smoke, try to quit using methods such as counseling, using nicotine replacement products, or prescription medications. Weight control. Maintain weight within reasonable limits through diet and exercise. Monitor your body mass index, BMI, and waist circumference to make sure you are not overweight or obese. 2. Manage risk factors. Blood pressure control. Monitor blood pressure regularly. Use medication as prescribed by your doctor if necessary. Cholesterol control. Monitor blood cholesterol levels. Eat foods that help lower cholesterol, such as fish, olive oil, and foods high in fiber. Use medication if prescribed. Blood sugar control. Manage diabetes by monitoring blood sugar. Use medication or insulin as prescribed by your doctor. Stress management. Practice stress reduction measures such as yoga, meditation, and relaxation activities. Maintain healthy social relationships and seek support from family, friends, or a psychologist when needed. First aid and emergency care for myocardial infarction. 1. Call emergency immediately. Call the emergency number 115 in Vietnam immediately if you suspect someone is having a heart attack. Provide clear information about the patient's symptoms and specific address. 2. Keep calm. Encourage the patient to sit or lie down to rest, stay calm, and avoid panic. If the patient is awake, have them sit in a comfortable position with their head raised higher than their body. 3. Chew or swallow aspirin. If the person is not allergic and has no contraindications, have them chew or swallow an aspirin tablet, usually 160-325 mg, to help thin the blood. 4. Use nitroglycerin, if any. If the patient has been prescribed nitroglycerin, give it to them as directed by the doctor. Place the nitroglycerin tablet under your tongue and let it dissolve slowly. 5. CPR, cardiopulmonary resuscitation. If the person loses consciousness and is not breathing or has no pulse, perform cardiopulmonary resuscitation, CPR. Chest compressions. Place your hands on top of each other and place them in the center of the person's chest. Press firmly and quickly at a speed of about 100 to 120 times minute to a depth of 5 to 6 centimeters, CPR. Blow air into the patient's mouth after every 30 chest compressions if you have been trained. Otherwise, just focus on continuous chest compressions until medical personnel arrive. 6. Using an automated defibrillator, AED. If an AED is available and you have been trained, use it according to its instructions. Place the AED electrode on the patient's chest and follow the instructions. Note: handling myocardial infarction situations needs to be quick and timely to increase the patient's chance of survival. Myocardial infarction, MI, commonly known as a heart attack, is a serious medical condition that occurs when blood flow to part of the heart muscle is blocked, often due to a blood clot in a coronary artery. This leads to damage or destruction of myocardial tissue due to lack of oxygen. The severity of a myocardial infarction depends on many factors, including the extent and location of the damage, the length of time it lasts before treatment, and the patient's overall health condition. Below are factors that indicate the danger of myocardial infarction. 1. Myocardial damage. If a large area of heart muscle is damaged, the heart's pumping function can be seriously impaired, leading to heart failure or other complications. Larger areas of damage can lead to death if not treated promptly. 2. Time. The longer the time from the start of symptoms to treatment, the more serious the damage to the heart muscle and the more difficult it is to recover. Prompt treatment, within hours, can minimize damage and improve chances of survival. 3. Location of the lesion. Damage to large or important coronary arteries often causes more serious consequences. Damage to the area of the heart muscle responsible for the main blood pumping function can lead to more serious complications. 4. Overall health condition. People with underlying medical conditions such as diabetes, high blood pressure, or other cardiovascular disease are at higher risk and often have a poorer prognosis. Elderly people or people with unhealthy lifestyles, smoking, sedentary, unbalanced diet, are also at higher risk. 5. Complications. Complications can include heart failure, arrhythmia, abnormal heart rhythm, cardiogenic shock, when the heart cannot pump enough blood to supply the organs, and pericarditis. Some patients may experience complications such as blood clots, causing recurrent strokes or heart attacks. 6. Mortality rate. Myocardial infarction is the leading cause of death worldwide. However, survival rates have improved thanks to advances in treatment and medical care. A heart attack is a medical emergency and needs to be treated immediately. Early recognition of the signs and symptoms of a heart attack, such as chest pain, shortness of breath, nausea, sweating, and sudden fatigue, is important to minimize damage and improve outcomes. Chance of survival.